Surgery at St. Elizabeth Hospital. If you were directed to arrive at the hospital between 5 and 5:30 a.m., they'd prefer you use the emergency entrance, which is located on South Oneida Street. Once you enter through the doors, there'll be a sign directing you to the surgery and procedure area. If you were directed to arrive after 7 o'clock, they'd prefer you coming through the main entrance, also located on South Oneida Street. Feel free to use the valet parking. Once you enter the lobby, you'll be directed to the far left corner, which is the registration area. At the desk, you'll be registered for your procedure, and someone will walk you down to the surgery and procedure area. Once you enter the spa, you'll be checked in at this desk. Your loved ones will be able to wait for you in this waiting room and follow you through your surgery process on this electronic tracking board, as you'll be directed to the prep area in order to get ready for surgery. In the prep room, you'll be changing into a gown. You'll have an IV started. They'll go over your current medications. They'll go over your up-to-date medical history. You'll sign your surgical consent, and you'll also be able to meet your operating room nurse and your anesthesiologist. Any last-minute questions that arise, this would be the time to ask those. Also, this is the room you'll hang out in until you're ready to roll to the operating room. Once surgery is complete, you'll be rolled into the recovery room, an area you most likely will not remember, but you will be hooked up to the monitors here. They'll be monitoring your oxygen, your heart rate, your blood pressure, and your temperature. They'll also be managing your pain and making sure that's under control, along with doing neurological exams to make sure that you are progressing in the right direction to recovery. The average time spent in the recovery room is usually between 1 and 2 hours, and the nurses here will make sure you're stable in order to move you on to the next stage, which is your room. Here are some photos to acquaint you with your room and where you'll be staying after surgery. To the right here is a whiteboard that's used for communication. This will include your provider's name, your nurse's name, potentially a discharge planner's name if they're involved, and also a list of goals for discharge for you. This here is an IV pump. This will be used to give you IV fluids, IV antibiotics, and also potentially IV pain medication. This here is an oxygen monitor, which also monitors your heart rate. They'll be checking those things intermittently to see how your body's responding to medication. This is the actual pump that's used to inflate and deflate those wraps, those sequential compression devices that we discussed earlier to help prevent blood clots. And lastly, you'll notice the raised toilet in the restroom along with grab bars for safety. We hope that this information has helped answer any questions and eased any anxieties regarding your upcoming surgery at St. Elizabeth Hospital.